It's Brain Awareness Week, so for our In Sickness and in Health segment, our friends at Adventist Health Castle want to help us take better care of our brain. Dr. Corey Liow is a neurologist at Adventist Health Castle. Thanks for being here. Appreciate it. Okay, so we've heard of Heart Health Month, taking care of your heart, but what is brain health and brain awareness? Because it's Brain Health Month.
Right, aloha. The brain is just like the heart. It's a remarkable organ. It allows us to experience the world, and it helps us to learn new things, remember things, and enjoy our world. Simply put, brain health, John, is just doing things that would maximize our potential to keep our brain active and minimize the risk that might reduce our function to allow us to live a fulfilling, productive life.
Okay. Are there exercises, are there tests that you can take or do, exercises that you can do to help with your brain health?
Absolutely, John. Just like heart health, you know, the brain health is very similar. I often tell my patients that come to our brain health clinic 4 things. Number 1 is eat up. You know, just eating a variety of food, make sure there's veggies and fruits, and make sure the fruits are colorful, like having berries in them with oxidants. And the second thing is get moving. A lot of us just kind of come home and sit in front of the TV. I often tell my patients, even if you could just do 15 minutes a day, get walking in the neighborhood, walk the dog, it's often so good for the brain. The 2 other things that are a little bit unique to brain health is to stay connected. Believe it or not, John, our ohana and our friends are actually good for us. The studies really show that when people are involved in a social setting, when they're using speech, vision, and sound, you know, to stay connected, it's actually very healthy for the brain. The last thing is to discover new talents. You know, our brain is an amazing organ. It has the ability to form new connections. So I often tell the patients, learn something new. Pick up a new hobby. You know, perhaps today when you go home, just drive on a different road to get home.
Which doesn't work for everyone, especially if you live on the west side, because there's only one way in, one way out. But, that is really interesting, because a lot of people don't think about feeding your brain or exercising your brain. It's not something that you talk about every day. Are there any other lifestyle changes that you can make for your brain?
Well, one of the easiest thing to do, John, is just changing up your diet.
Yeah.
For example, you know, eating less processed food.
Okay.
You know, and cutting out the high fats, the high diet, high caloric, high sugar diet. You know, these are simple lifestyle changes that we can make right away. You know, and I tell my patients, you know, even when you don't feel like on a day you don't feel like get moving, just go out and into the garden or do something or walk your dog. As simple as 15 minutes, 3 times a week will make such a difference.
How does making changes like this help for, say, strokes or Alzheimer's?
Well, great question, because stroke and Alzheimer's are big, especially in Hawaii, affects many of our people on the island. So by maintaining a good brain health, it actually lowered the risk for some of the what we call modifier risk factors for stroke. You know, so by eating better, by exercising, by staying connected, by discovering new talents, it actually will reduce some of our risks and perhaps delay the onset of Alzheimer's. And being healthy, eating healthy, and exercising, it also helps to prevent stroke.
Okay. You also have done some research on Alzheimer's, obviously, as a neurologist, I'm sure. Could you tell me a little bit about that, real quick?
Absolutely. We know that we can really prevent Alzheimer's. You know, we know that the proteins in the brain builds up as early as 20 years before we actually lose the memory. So right now, what we're doing, John, is we're looking for patients who have yet to develop memory loss, but between 60 to 75 years old, who has a family history of Alzheimer's. What we really like to do is put them on the study medications. We hope to prevent the buildup of these abnormal proteins in the brains. That will last 5 to 8 years. They'll be followed up at our memory clinic by our neurologist and our neuropsychologist. Our hope is that by taking this medicine, it would prevent them from developing Alzheimer's. We don't know yet, but it is really our goal to do that.
Doc, thank you so much for being with us. And if any of you would like to know more about brain health or brain awareness, you can always visit it at Adventist Health Castle online or visit Doc, right?
Absolutely.
Perfect. Thank you so much for being here. I appreciate it.
My pleasure.